Restructuring or transformation is the process of changing the structure of a dataset to a form that allows for analysis. Depending on the desired outcome, there are three types of restructuring. Converting observations into variables, variables into observations, and full data transposition, which transforms all observations into variables and variables into observations in the new dataset. In this presentation, we will focus on the variant that transforms observations into variables. This option should be selected when the data file contains related rows that should appear in separate columns as variables in the output file. The presented data show the results of a medical experiment involving the administration of a new type of antihypertensive drug to 10 different people. Blood pressure is measured for each patient before and after taking the tested drug. To determine the drug's effectiveness, a statistical t-test for dependent samples, comparing means before and after taking the drug, needs to be performed. Since the current form of the dataset does not allow for the use of the mentioned test, we need to restructure the observations into variables, transforming the data into the form shown on the right side of the slide. To do this, go to the Data menu and select Restructure. Then, select the option Restructure Selected Cases into Variables and click Next. In the section Identifier Variables, place the variable patient, which will help the program identify each group of observations. Leave the Index Variables section empty and click Next. The Next tab in the wizard allows for sorting the data in the dataset. Sorting is required by the program for restructuring, so leave the default option. Informs the program that the data has already been sorted previously, and there's no need to perform this step. The section order for new variable groups allows you to set the sorting order for the data in the output dataset. Since we did not specify any indexing variable in the previous step, leave the default grouping option, which is according to the patient variable. At this stage, the wizard also offers the option to create an additional counting variable that will contain information about the number of observations used to create the new row in the output dataset. Finally, proceed to the last window of the wizard and, leaving the default option Restructure Data, click Finish. As you can see, the result of our action is a transformed dataset that allows for conducting tests. The restructuring operation does not cause any loss of information, as may happen with aggregation, and it is a fully reversible process. The variety of options offered by the restructuring wizard is extensive, so I encourage you to experiment with the available settings of this procedure.